Thank you, Mayor. So part of the silver lining is you've all been hearing about the vaccine. And one of the things we've said is we're going to get out of this pandemic when we have strong therapeutics, medicines that will work, and a vaccine. So we started planning for vaccine before the schools even started. We started in August to begin planning for the vaccination of what we're calling the population of Winnebago County. So you will not hear us call it a mass vax. We're going to call it a population vaccination. So I have to tell you, at the health department, I recognize that we did not have the bandwidth to plan for this next phase while we were still working to get schools back in person, that we had all anticipated a fall surge. We were still contact tracing and quarantine. I will also tell you that as we started to hear about the vaccine trials, we recognized the complexity of what we were going to be facing. We understood from the beginning that these vaccines would require some super cold chain. I'm not even sure if I really understood what that meant at -70. That there'd be multiple products. We'd have to have 2 vaccinations. And of course, we'd have limited quantities just to make it a really nice time. And we would have to prioritize that when you have limited quantities, we got to decide who's going to go first. We also knew that we had to care and have a lens of equity and outreach to disproportionately impacted populations. So that included our individuals in our communities of concern and zip code, if you've seen that, our long-term care facilities and congregate settings, our healthcare providers, and our individuals with pre-existing conditions. So we began to assemble the team. So for those of you who've been watching, we've talked about emergency operations. We decided to put this under our planning section chief, who is our emergency response coordinator, Rebecca Lyons. And we went out to the College of Pharmacy because we knew that there was subject matter expertise that we could pull in to start to help us to plan for that. So through the direction with Dr. Rinn, who is the Dean of Pharmacy, we called upon Chris Schriever. He's the clinical assistant professor of UI College of Pharmacy, and he's also a pharmacist in practice at Crusader Community Health. The planning team included Dr. Gary Rifkin, a professor emeritus from the University of Illinois College of Medicine, who also was one of the pandemic leads in preparing medical students for this. Dr. Sam Pope, a clinical associate professor who specializes in microbiology and chemistry. We also have the Rockford Region Rebounding Healthcare Work Group that was chaired by Sharice Hunter from the City of Rockford, and the Regional Hospital Coordinating Center under Dr. Matt Spatana and Stephanie Cushell. So that's the planning section. Then we have the operations section. How are we going to carry this out? So we called upon Natalie Parker, who's a nurse practitioner at the University of Illinois and the Winnebago County Health Department, Dr. Alex Thorpe, a postgraduate resident at the College of Pharmacy, and Mayor Steve Johnson, a CVS pharmacist and the mayor of Machesney Park. Under logistics, we pulled in another pharmacy team, Dr. Marianne Popp, a clinical assistant professor at UIC, and she also is a practicing pharmacist at OSF Healthcare, St. Anthony Hospital, and I was her backup on logistics. So now I'm going to turn it over to our planning section lead, Dr. Chris Schriever, to give us some outline of what we're planning to do next in the vaccine.
Thank you, Dr. Martell. So we have a diverse group of individuals from this town. In initial meetings, we were wondering, based on the population of a little under 300,000, how are we going to carry out this event? How are we going to immunize those most at risk? What are some of the questions the community is going to have? And we were fortunate in the planning stages during some immunization drive-ups to have surveys. And we were able to survey immunization recipients at that time and said, when you do get the COVID vaccine, are you going to take it? If you choose to, that's great. If you choose not to, why not? And we were able to gather some information and really kind of help us hone in and figure out what we needed to put a lot of our effort and emphasis into doing. So from our poll and our survey that we have, about a quarter, 23.4%, had safety concerns. Effectiveness was another one. about 19.6, followed by cost, a little bit under at 18. And the three remaining ones, time off of work, transportation, and fear of needles. So knowing this list, the top three made up about 60% of what patients had concerns with. As far as the other four, fear of needles, like to do something about that, but there's really nothing that we can say that's going to make you not fear a needle. If you fear a needle, that's what you have. Transportation. Knowing this, we could identify different ways when we have the event. How can we take transportation out of the equation? Can we make it more convenient for the individuals that we're looking to vaccinate? Time off of work. And I'll touch on this when I talk about a couple of the different dispensing scenarios that we have set up. Cost, naturally that is always a concern in everything with healthcare. With cost, this should be, and everyone should be able to get the vaccine for free. Now, when individuals go to a pharmacy or go to a provider, they may bill their insurance for an administration fee. However, the cost of the vaccine is not going to show up. And if they do not have the enough for the administration fee, that cost is going to be waived. So that's one thing of the three main concerns that we have that we can get rid of. Effectiveness. Now, this survey ended toward the end of September. We now have 3 drug studies that have come out and shown effectiveness at over 90%. The FDA, CDC, and when all these trials were going on, they were very hopeful that at least they got 50%, but they wanted to get a 60% efficacy rate. They really blew it out of the water by getting up to 90%. And that we had not only one, but we have 3 vaccines that will soon be available. So I think the effectiveness of the vaccine is much less of a question and should be in our mind as we look at the products that we're going to have available. Safety concerns. Where are we now with safety concerns? We know that a couple of companies have already submitted some of the safety data for emergency use authorization. We have 2 months of safety data following before they can submit. Every day that goes by, we are collecting more and more safety data. So I think by the time that it starts getting widespread use, we can feel fairly comfortable about where we are with the safety profile of the different vaccines. Our group has sat on CDC, FDA calls regarding how we're going to implement this vaccination scheme. What are we going to do? They also talked about the different vaccines. Besides the efficacy that they were looking for 50 to 60%, one of the concerns they had is how do we make sure that this is a safe vaccine? And this was one of the front parts of their concern. Primarily because if a bad vaccine goes out that's not safe, that is not advantageous to anybody. It would further inhibit anybody else from taking another vaccine down the road. So this has always been of importance to the group going through and promoting use of this vaccine. So now that we know the areas that we have to concentrate on and where we can go educate on the effectiveness and the safety that we have so far from the vaccine, how are we going to do it? We roughly categorize 3 different groups as tiers. Tier 1, Tier 2, and Tier 3. And as we look to distribute vaccine, we're going to start with that highest risk group, the group that has the most direct or indirect contact with those at risk. And those are the ones that we think of as our frontline workers. So our Tier 1A, we're identifying those hospital workers, those clinicians, pharmacists, those in dialysis centers, first responders, emergency management personnel, those who are going to be right there on the front line. As we move and we get that medical infrastructure vaccinated, we'll go on to some of the other more high-risk places. Long-term care facilities, correctional facilities, shelters, congregate living and group homes. And we'll look to vaccinate those next at risk. How are we going to do that? One of the terms you're going to hear used is a POD, point of dispensing. And at each one of these facilities, we intend to have its own point of dispensing, where medication will go to that facility and it'll be self-contained. And those individuals within that healthcare center within that long-term care facility, within that clinic. They will vaccinate those frontline workers first. And once we get that, then we'll start going out to asking the question, okay, who's next? So then we'll go into phase 2. And phase 2 will also have some of this closed pod, is the term that I've used. And some of the individuals we've identified in phase 2 are those adults with high-risk conditions, those over 65, those with obesity, diabetes, hypertension, cardiac, and the list goes on. We'll look for other areas of infrastructure. Now, when I talked about infrastructure in stage 1A, we're looking at those workers who are right up there with the patients, who have the direct patient contact. The other areas of infrastructure that we're thinking to make this whole exercise go off without a hitch, those in public works, human services, and other governmental service and personnel. Once we get to stage 3, this has become what we're going to call, when we get everybody. And this is going to be more of an open pod structure. So from here, we're going to look and leverage the connections that we have in the community to find the places where we can best set up these open pods, pods where anybody can come by and get their vaccine. So we have to be very aware of who's at risk, finding some of those patients that have disproportionate risk. And as Dr. Martell said, some of those zip codes where we're seeing higher morbidity, mortality numbers. We have to find those places and strategically make sure that we have some of our pods so we're not missing anybody. So as of today, we're still going through and we're finalizing some of these areas that we're going to use for an open pod. It's going to be a bit challenging because it's probably going to be when it's cold. And as everybody in Illinois knows, it doesn't start warming up till June. So we're hopeful that we can get that finalized fairly shortly, and that's when we look to immunize everybody. So where are we at now? As we stand right now, we've started using the services of an outside contractor to develop a computer program to interface all this, so we can communicate not only with the state, but within the different healthcare institutions within the area and with the county. As immunizations are given, we will look to see which one did the patient receive. The vast majority of the vaccines we're going to get is going to be a 2-vaccine series. So we have to make sure that they get the same vaccine. We need to give reminders. We need to communicate that with the state. We need to communicate that with the federal government. We also need to communicate any adverse side effects. And we're going to do this logistically with this company to facilitate the use of cellular phones and facilitate the ease for patients to communicate this back with us. So this is truly, and to throw the other kind of final wheel in there that, muddies the water a little bit, the date of when the vaccine is going to be released, we've been planning, and this has just been a moving target. And you're kind of waiting to catch that fly ball, and it's coming, and that's what we're doing. And this has been a moving target. And so when it comes, second week in December, third week in December, we wish we had a great answer to tell you. Nobody's telling us yet so far, but it's definitely on the horizon. So this was truly a community-wide operation, and we really feel we have all the necessary players involved. We have a good system in place for identifying all of those individuals, especially those high-risk individuals and those with disproportionate risk. We don't want to miss anybody. As I said again, to use the term, it's a moving target, but we think with our group and the infrastructure that we have within our group that we will be able to maneuver, manipulate any challenges or complications that should arise during this process. Dr. Martell?
So kind of talking and building up from that point, that silver lining, something to look forward to. But we still are in a very fragile time frame where, while we're getting increased number of cases, our positivity rate. So similar to the mayor, enforcement of Tier 3 mitigation continues in coordination with the city of Rockford, and because they have an intergovernmental agreement with us to do enforcement. And I want to be clear, I get a lot of questions on bars and restaurants. The focus is not just on bars and restaurants. Retail establishments must also follow the Tier 3 mitigations. And I want to be clear because it's come up, and probably the mayor's too kind to say it, but intimidating or threatening a code enforcement officer of the Winnebago County Health Department or any municipality carrying out their duties is not acceptable and is punishable. So if you feel that that's the way that you must step away, understand that they are doing their work. So in order to get the vaccine, little transition, we got to get through this part of the pandemic. We got to be around to get it in our arms. So we're happy to be celebrating our Thanksgiving. I think you've heard enough now. Please adhere to the guidance around celebrating the Thanksgiving holiday with your household. Staying apart doesn't mean you shouldn't stay connected. I've seen very creative ways people are doing drive-by, progressive dinners where they leave a dish out and you change it out. Zoom, FaceTime, Google Duo. I know the schools have all said that kids can use their laptops or mobile devices to help connect. Remember to visit your loved ones in congregate settings by window visits as appropriate. Do a porch visit. You can socially distance and do a porch visit. Weather looks like it'll be not quite snowing and blowing on Thanksgiving Day. Shop Black Friday sales from the comfort of your own home and have the items shipped or picked them up curbside. And remember to shop local on Saturday. I think the mayor put it well. Many local businesses have online presence or they'll take a phone order. And adhere to social distancing guidelines to make it safe for you. Find out what their hours of operation are. They will let you know when the peak times are so that you can go in. But shop local. Support our local businesses. Do takeout from one of our local restaurants that you would normally gather at after the holidays. And also at this time, remember the charities. They haven't been able to do the coat drives, the food drives, the toy drives. Buy gift cards online and send them so that our families in our community who've suffered tremendously can have some gifts at the holiday time. I keep coming back, the goal's in sight. Our goal is to stay safe and stay healthy so that we can get vaccinated. So with that, I'll report the new cases for today. We are reporting 183 cases today. Our total case count in Winnebago County is 17,538. The ages are 6 months to 91 years. So as we've emphasized, no age is spared. And unfortunately, we lost 4 additional members of our community, which brings our total death count in Winnebago County from COVID-19 to 242. And yes, our positivity rate is decreased to 15.8, and we're equivalent with our regional positivity rate. The hospitals are reporting that there are 166 individuals hospitalized with COVID. And the good news is this is down from the 193 last week. But again, it's only 27, and I just told you how many new cases we have. New locations of concern since last Friday include Forest City Rehab and Nursing. And despite going through a pandemic and rising positivity and transmission, we do have 2 locations that are coming off the locations of concern because they have had no new cases within 2 incubation periods. Ken Rock Elderly Apartments, a Milestone Southbridge. So again, I want to remind everyone, in order to get vaccinated, we got to be here. So we got to take every necessary precaution. Do what you can do. Wear your face coverings, maintain social distancing, wash your hands frequently, and avoid gatherings.